we're talking about this. Today's doctor segment is actually about heart health for National Blood Pressure Education Month. With me now, Dr. Dave Cox. He's an interventional cardiologist at the Cardiovascular Associates over at Brookwood Baptist, and we're just going to be chatting about some of that stuff. And we were talking before the commercial break there about this ban that the World Health Organization is calling for. And what are your thoughts on that?
Well, it's pretty incredible. It's been done in some cities, actually. Philadelphia and New York have tried to do this on a smaller scale. But, you know, the point is, we really don't know that all fats are bad for you. So we know that avocados, and there's good fats.
Right.
And the idea here is really trying to get you to eat less processed food.
Right.
I think people say, what's a trans fat? If it's in a processed food, that's a trans fat.
And I know this may seem kind of not like the smartest of questions, but sometimes people may not understand the difference between non-processed food and processed food. So if you can just clarify that for us really quickly.
Processed food, I think, means if you go into a 7-Eleven or something like that and it's in a plastic package, that's a processed food. If your mama cooked it for you, that's probably not a processed food. All
right. So kind of people need to start paying attention to those kind of things. And especially, you were just talking about some changes in the ratings or rankings of the numbers of blood pressure, high blood pressure patients across our country.
Right. We have a real challenge right now, and I think sometimes patients get caught in the middle of this. Last fall, the guidelines changed, saying basically 140/90 is no longer the target for high blood pressure. Everybody should try to get down to 130/80. And the challenge, of course, is that means that a third of patients had high blood pressure last fall. Overnight, half the patients in America have high blood pressure. So I think it comes down to trying to get a healthy lifestyle and lose some weight, keep away from trans fats and processed foods, and pay attention to your blood pressure. I think we don't want to get patients caught in the middle.
Right.
And so I think having a healthy discussion with your doctor and having her go over the guidelines and seeing how it fits with you is probably the most important course.
So you're saying with these new guidelines, now half of the country suffers from high blood pressure, according to these new guidelines.
That's right.
So of course, if people are at home and they're hearing this and they were already in that 1/3 and now they're hearing this, does that mean that does that mean their condition's worse, or how does that go exactly?
Well, it means there's a lot of people out there that we really have to say would have less death from heart attacks if we got their blood pressure lower. And I think the cost you can pay is a little bit of dizziness, and you have to take an extra medicine.
Right.
But I think we all have to look at the fact that the #1 cause of death in America right now is still from your heart. And if we can do anything to lower that risk, I think we need to think hard about it.
So I know people down south, we all like to eat our really good food, a lot of it processed, but just kind of obviously in moderation and paying attention to how your body's feeling, correct?
Absolutely, Kelly.
All right, if people have any other questions about these changes, can they contact you with those questions?
That's right. I think the first step is to talk to your primary care doctor, and I think that person is pretty into tune of all
what's
these.
What's going on with your body too.
What we don't want to do is get caught in the patient in the middle of some of the controversy, because some of the primary care academies and organizations have not embraced the new guidelines. So your cardiologist may say you need to get less than 130/80, and your family practice doctor says 140/90 is fine. And I think rather than having our poor patients get caught in the middle of all this, I think we really need to just have the discussion.
All right. Well, thank you so much for joining us. Again, talk to your doctor, because your doctor knows your body best. Thank you so much for being with us. We appreciate that.